Bismillahirrahmanirrahim. Assalamu alaikum. I'm Rabia Gulnaz from King Edward Medical University. Today I'll discuss orbital cellulitis and I'll discuss these points. First of all, definition. It is acute purulent inflammation of orbital tissues posterior to orbital septum because anterior is preseptal cellulitis. Etiology. These common microorganisms infective. Then comes mode of infection, penetrating injury, extension of infection, sinusitis, teeth infection, face infection, lips infection, blowout fracture, metastasis from the septicemia, post-surgery, especially strabismus, and then come symptoms. Severe pain on eye movement because restricted extraocular movements, swelling of eye, high grade frequent fever, watering, redness, photophobia, and then comes sign. Chemosis of conjunctiva, proptosis is one of the major sign. Eyelids warm, red, tender, ocular movement restricted, optic nerve dysfunction, decreased visual acuity, RAPD positive, and then presentation as you can see clear. There is a redness, there is a swelling, there is proptosis, tender eye, and then comes the complication, keratopathy because of exposure of cornea, optic neuropathy, panophthalmitis, whole orbital inflammation, purulent meningitis, thrombosis of cavernous sinus, and then which can lead to the death. And then comes investigations, CBC, first of all due to any bacterial infection, culture and sensitivity, orbital ultrasonography, X-ray, CT scan, MRI. Here is an MRI. As you can clearly see, there is a proptosis. You can see there is a inflammation behind the eyeball. And then treatment, medical and surgical. Medical therapy, we go through IV and systemic antibiotics, steroids for inflammation, analgesics for relief of pain, topical antibiotics for corneal exposure and chemosis, artificial lubricants, lid taping at night because due to proptosis patient can't close eyelids, so we tape at night to avoid the corneal drying. Optic nerve test due to steroid use, IOP can be raised. If it is raised, we have to start the anti-glaucoma drugs. If there is no response to medical therapy, we perform surgery. Sinusectomy, drainage of abscess from the sinus, lateral canthotomy, we incise the lateral canthus, and we continue to incise until there is a bone, and then we break the bone and we drain the pus, and then we perform the sutures and this clear of the abscess. So that's it. And there is, in the next diagram you can see there is how this step leads to the cavernous sinus thrombosis. So that's it. Thank you.